Perfusion. What is perfusion? It's the forcing of the blood or some other fluid and forcing it to flow through a vessel, then through the heart and through the lungs, into a capillary bed or a tissue, and ultimately it's to provide oxygen. So let's go back to cardiopulmonary circulation. See, the blood circulates from the body through the heart and the lungs. From the body, the blood flows to the right heart, where the right heart has to have enough strength then to pump it into the lungs. Now, up until this point, the blood has had not a lot of oxygen in it. Within the lungs, it picks up oxygen, and the force of the entire circulation pushes it on to the left heart. And from the left heart, the blood is pumped back into the body. So the left heart has to have the strength to push the blood out of the heart and into the body. Well, perfusion depends on a lot of things. It depends on the blood itself. Is there enough blood? And does the blood have the components that's needed to pick up the oxygen and carry it to the body? So we're talking about red blood cells, iron, and hemoglobin. The blood vessels play a part. They need to have intact receptors and an intact parasympathetic and sympathetic nervous system so that the vessels respond appropriately in contracting or constricting and dilating. And the circulatory system itself needs to be intact without any major tears in it. So the heart has to have adequate cardiac output. And it also has to have an intact autonomic nervous system to tell it beat faster or beat slower. And the circulation to the heart has to be adequate, meaning all the blood vessels that feed the heart muscle itself needs to get adequate oxygen. The lungs have to be able to adequately ventilate and adequately diffuse. And there needs to be an intact pulmonary circulation. So we need to have a pulmonary system where the bronchioles don't collapse, where the alveoli are not full of fluid, and the lungs themselves are adequately, the lung tissues are adequately oxygenated. The body needs to have adequate uptake of oxygen. It needs to have the circulation available to be able to take in the oxygen from the blood vessels. So altered perfusion is the inability to adequately oxygenate the tissues at the capillary level. Why does this happen? Well, causative factors include a ventilation-perfusion mismatch, impaired circulation, inadequate cardiac output, and excessive perfusion demands. What does that mean? It means there's problems with the lungs, or problems with the vessels, or problems with the heart, or problems someplace else in the body. Ventilation-perfusion mismatching. The lungs are well perfused but inadequately ventilated. That means, you know what, there's good blood vessels running around there, but we've got some kind of obstruction in the bronchi or the bronchioles. An example here is COPD. Or the lungs are well ventilated but inadequately perfused. Diffusion is blocked. Oxygen can't pass through the alveoli into the capillaries. An example here would be fluid in the alveoli or collapsed alveoli. Problems inside the vessels. Well, blood vessels can be injured. And example here is atherosclerosis. Blood vessels can be obstructed, such as a thrombus, or there's vasoconstriction from hypertension. Or there's inadequate blood volume. That's hypovolemia. Problems with the heart. Inadequate cardiac output. Why does that happen? The muscles are too weak. We have impaired pumping. There's some kind of heart defect. Or maybe the heart is not getting the message. The autonomic system is not able to send the message to the heart, beat faster, beat slower. Or there's changes in the peripheral vascular resistance, meaning the heart is trying to push the blood out, but it's meeting such a pressure on the other end. Maybe the blood vessels are so small, the heart is having to beat much too hard and can't actually get the blood into the vessels adequately. Problems in the body elsewhere often means excessive demand. Something's happening in the body that it needs way too much blood, way too much oxygen. Inadequately ultimately means not enough oxygen to the tissues. And that depends on the cause. The general manifestations depend on which tissue isn't getting enough oxygen. If we're looking at the skin and the integumentary, we're going to see cyanosis and pallor, coolness, maybe some edema. Cardiopulmonary, we'll see pain, shortness of breath, tachypnea, tachycardia, heart murmur. If the problem is in the vasculature, we're going to see hypotension or hypertension. We might see some coagulopathy, such as bleeding and bruising. And in general, we may see a lot of fatigue or impaired growth.